morning. My name is Franz Jasmine Swanaria, your student nurse from Davao Doctors College. And today, I will be performing a return demonstration of vital signs taking. Now, taking vital signs in every patient visit can be vital to the health of the patient. Vital signs include body temperature, blood pressure, heart rate, and respiratory rate. So additional vital statistics used to identify predisposition of disease or disorder, and that assists a proper dosing of medication includes height and weight. Before doing the assessment, we should verify what we need to perform the vital signs taking. So first is to check for the document or the medical record of the client. Of course, don't forget to check for the needed equipment, including the thermometer, to measure the temperature gradient, the hotness or coldness of the patient, the stethoscope, to listen to the internal sounds of the human body, BP apparatus, of course, to measure the blood pressure, cotton swabs, to clean to clean the earpiece, diaphragm, and belt of the stethoscope, sterile gloves to protect ourselves from the client, and of course, the alcohol to sanitize our hands. So now we're going to proceed to the working phase. First of all, provide the client's privacy, introduce yourself, and of course, verify the client using the two identifiers, and don't forget to perform hand washing. Hello, ma'am. May I come in? Good morning, ma'am. My name is Franz, your student nurse for today. So, may I know your name?
Okay, ma'am.
Okay, so when is your birthday?
February 16, 2002.
Okay, so, what do you want me to call you?
Anything you want.
Okay, so I'll tell you, the procedure that I will be doing is that I'm going to take your vital signs. So, I'm going to touch some parts of your body. And of course, there are a lot of procedures or movement that you should follow. Is that okay with you?
Yes, ma'am.
Okay, so if you feel uncomfortable, feel free to raise your concerns. And of course, some of the information that I will be getting is secured and safely handed to the doctors. So place the client appropriately. Wipe the tip of the thermometer using the alcohol swab in a firm twisting motion prior to its placement from stem to probe. So place the thermometer, and now I'm going to perform the oral method. So place the tip of the thermometer in the side of the frenulum. So Althea, can you open your mouth and raise your tongue? Okay, so I'm going to put this, then close your mouth. And don't forget to turn on the thermometer. So wait for the appropriate amount of time after its placement. So the electronic thermometer indicates the complete reading through light or tone. So Althea, you can open your mouth now. Okay, so you have 35.9 degrees Celsius. So remove the thermometer and wipe the tip of the thermometer using the alcohol swab in a firm twisting motion prior to its placement from stem to probe to lessen the spread of the contamination. So wipe this from the less to the most contaminated area. Also, don't forget to discard the gloves and perform hand washing. Wash the thermometer if necessary and returns it to the storage location. Of course, document the temperature to the client's record. For the auxiliary temperature method, ensure the client's privacy and of course help the patient to the supine or sitting position. Althea, I'm gonna move the gown away from your shoulder and arm. Is that okay? So can you raise your arm away from your torso for me? So of course, inspect the auxiliary area for any lesions or perspirations. And pat the area or the auxiliary area dry if needed. So Althea, I'm gonna put this thermometer in your arm now. So can you close your arm? And of course, don't forget to turn on the thermometer. So wait for the appropriate amount of time after its placement. So electronic thermometer indicates the reading or the complete reading through light or tone. So Althea, I'm gonna remove the thermometer now. So you have 35.7 degrees Celsius. So remove the thermometer and wipe the tip of the thermometer using the alcohol swab in a firm twisting motion prior to its placement from stem to probe to lessen the spread of the contamination. So wipe this from the less to the most contaminated area. Also, don't forget to discard the gloves and perform hand washing. Wash the thermometer if necessary and returns it to the storage location. Of course, document the temperature to the client's record. The radial pulse first assess to the factors that can affect the rate and rhythm, such as medical history, disease process, age, exercise, and medication. Help the patient to the supine or sitting position. Hello, ma'am. May I come in? Good morning, ma'am. My name is Franz, your student nurse for today. So, may I know your name?
Althea, ma'am.
Okay, so when is your birthday?
February 16, 2002.
Okay, so, what do you want me to call you?
Anything you want.
Okay, so Althea, the procedure that I will be doing is that I'm going to take your vital signs. So I'm going to touch some parts of your body, and of course, there are a lot of procedures or movement that you should follow. Is that okay with you?
Yes, ma'am.
Okay, so if you feel uncomfortable, feel free to raise your concerns, and of course, some of the information that I will be getting is secured and safely handed to the doctors. If supine, place the forearm along with your side with the wrist extended, then place the tip of your 2 or 3 middle fingers over the groove along with the thumb side of the patient's wrist. Then slightly extend or flex the wrist of the patient. Then come down until you feel the strongest pulse. So count for 30 seconds and multiply the rate by 2 if the pulse is regular. And if the pulse is irregular, count a full minute. Then don't forget to record the pulse beats per minute in the worksheet. Good morning, ma'am. My name is Franz, your student nurse for today. So, may I know your name?
Okay, ma'am.
Okay, so when is your birthday?
February 16, 2002.
Okay, so what do you want me to call you?
Anything you want.
Okay, so I'll tell you, the procedure that I will be doing is that I'm going to take your vital signs. So I'm going to touch some parts of your body, and of course, there are a lot of procedures or movement that you should follow. Is that okay with you?
Yes, ma'am.
Okay, so if you feel uncomfortable, feel free to raise your concerns, and of course, some of the information that I will be getting is secured and safely handed to the doctors. So to monitor respiration, observe a complete respiratory cycle or palpates and count respiratory rate. So I'll tell you, do you have past illness regarding respiration or are you asthmatic? Okay, so does anyone in your family smoke? Do you smoke? No? Okay. So, do you exercise regularly? Okay. So, I'll tell you, I am going to start the assessment now. Is that okay? Okay, so any clarifications? So, help the patient in a comfortable position, preferably sitting or lying in the head of the bed, elevated 45 to 60 degrees. So, make sure that the patient's chest is visible. Then place her arm in the lower chest or upper abdomen as you assess the pulse. So, observe a complete respiratory cycle, one for the inspiration and one for the expiration. Count 30 seconds and multiply the number of breaths by 2. So, respiratory rate normally ranges 12 to 20 beats per minute, and if it's irregular or less than 12 or more than 20 beats per minute, count in a full 60 seconds. So while assessing, observe the chest of the patient or observe the chest wall. So observe for dyspnea. Ask the patient to compare any shortness of breath. So Althea, do you have any breathing problems? Okay, so your respiratory rate or your breathing rate is 17, which is you are within a normal range. So any clarifications or questions? Okay. Hello, ma'am. May I come in? To take blood pressure by one-step method, first is to check the patient's baseline reading and document. Then, of course, determine the best site to use. Introduce yourself and identify the patient using the 2 identifiers. Hello, ma'am. Good morning. My name is Franz, your student nurse. So, may I know your name and your birthday?
Also, and in February 16, 2002.
Okay, so I'm going to take your blood pressure. So is that okay with you?
Yes, ma'am.
So now position the client appropriately. The client should be sitting unless otherwise specified, and the feet should be on the floor. So slightly flex the arm. So the palms facing upward or the palm facing up with the arm supported at heart level and expose the upper arm. So now ensure that the equipment is intact and functioning properly. So check for the cuff size, the tubing between the cuff and the bulb, and the sphygmomanometer. So make sure that the patient has not smoked and ingested caffeine within 30 minutes prior to its measurement. So I'll say, did you smoke or ingested caffeine or energy drink? Okay. Wrap the deflated cuff evenly around the upper arm. Then locate the brachial artery. Now, clean the earpiece, the diaphragm, and the valve. Then put the earpiece in your ear, ensure that it hangs freely. Then put the stethoscope on the skin and not in the clothes. Hold it with your 2 fingers. Then now, let's auscultate the client's blood pressure. Pump up the cuff until the sphygmomanometer reads 30 mmHg above the point where the brachial pulse disappeared. So now release the cuff until the pressure decreases. So as the pressure falls, identify the manometer reading. First is the carot cuff phase 1 or the systolic sound, which is the first loud sound you've heard. Then the carot cuff phase 4 or the diastolic sound, which is the sound became muffled and soft. Then the carot cuff phase 5, followed by the period of silence. Deflate the cuff rapidly and completely, and repeat the steps to confirm the accuracy of reading. So Althea, just relax because I'm going to repeat the procedure once again. So remove the cuff and disinfect. The last thing is that summarize the findings obtained during the working phase, provide the client the opportunity to ask or raise for concerns, and don't forget to thank the client or the patient for the time and cooperation, and perform hand washing. So hello again, Althea. So in taking your vital signs, your result shows that it's all normal and you don't have to be worried. So I will monitor you from time to time. So any concerns or clarifications? Okay, so thank you so much for your time and cooperation, and have a nice day ahead.